talk to you today about a slightly different take on hiatal hernia. It's something I speak about often because it has 15 different symptoms associated with it. It can be really debilitating and it's very misdiagnosed. If you need more data on hiatal hernia, there are several videos on my channel on YouTube, also on my website, rootcausemedicalclinics.com. There's several blogs and several videos. In summary, hiatal hernia is when your stomach pushes up against your diaphragm and starts pushing through the opening, and that's what a hiatal hernia is a hernia, something that's protruding through an opening that's inappropriate. So the stomach pushes up through the diaphragm, which is that tube that connects your mouth to your stomach. And so that tube passes through the diaphragm, which is the big dome-like muscles you have on either side that allow air to come in and out of your body, in and out of your lungs. And the diaphragm, as I said, two dome-shaped muscles, very strong muscles. And what can occur when that stomach is pushing either up against the diaphragm or protrudes through that opening of the esophagus, a number of different symptoms can occur. Some are some very obvious digestive symptoms like heartburn and acid reflux, sometimes pressure in the chest. There can be breathing issues because the diaphragm can't move as freely, so you're short of breath. Then there's other symptoms associated with anxiety and heart palpitations. And this is all secondary to that stomach being in spasm, the diaphragm not moving as freely as it should, not enough oxygen coming in, and your nervous system starting to kind of freak out about that inappropriate lack of oxygen. So it's not that you're not breathing, you are. It's just not enough, and your nervous system is very sensitive to that, and it registers that. So again, you can look at some earlier videos on the whole long list of symptoms, but what I wanted to talk about today is something that a patient brought to my attention after we had diagnosed her with a hiatal hernia. She said, you know, I went back and I looked at my endoscopy. Now, an endoscopy is something you would get from a gastroenterologist because you were complaining of digestive problems. Now, it could be GERD, that's a reflux of the stomach contents. It could be heartburn. It could be any sort of digestive disturbance, a feeling of fullness, bloating, trouble swallowing, burning in the esophagus. So it can be a number of different problems that would cause a gastroenterologist to do an endoscopy, but they're pretty common. And what often happens, and was the case in this patient, and I realized, wow, that probably happens pretty often, is that a small, either a mild hiatal hernia, a small hiatal hernia, what's called a sliding hiatal hernia, which means the stomach slides up and it slides down. You know, so but when it's sliding up, that's when it's creating the problem. So it doesn't mean it's stuck up there through the esophagus. A stuck hiatal hernia, where a part of the stomach is so far up above the diaphragm that it's stuck, that's rare. We don't see that very often. That's a surgical moment because the poor stomach can be starting to estrangulate, and it's an emergency type of situation. You can't digest food, you can't keep it down. It's dramatic. So you would know when you had that, and that's not what we tend to see here at the clinic at all. As I said, rare, and that's when surgery is the only option. So the reason you can get an endoscopy and have your doctor not mention a mild or small or sliding hiatal hernia is that they have, first of all, they have nothing they can do for you. They have no approved treatment for that, number one. And then number two, they don't think it causes any symptoms. I guarantee you in the next decade, hopefully shorter than that, it will become more obvious that there's a lot of symptoms associated with these mild, small, and sliding hiatal hernias. But at the moment, it's literally not mentioned because they don't feel it's significant. And if you Google hiatal hernia, that's what you'll see. You know, it's usually, they say it's usually found while searching for other things. It doesn't mean anything, which nothing could be farther from the truth. So I literally have patients with chronic panic attacks, chronic anxiety, chronic shortness of breath, chronic heart palpitations, all due to their stomach being in spasm. So my message today, over and above the other facets of this that we have discussed, is that if you've had an endoscopy in the past, you can look at it and see, get a copy of it and see, because they will mention it even though maybe your doctor didn't say anything. So, and then do appreciate there's one other aspect of this, which is if it's sliding, meaning it's kind of going up and down, you can get the endoscopy when it's down and they can miss it. So you can have a hiatal hernia of the sliding variety and they don't mention it because they didn't see it. It wasn't in that up position during your endoscopy. So if it's not mentioned, it doesn't mean you don't have it. But I feel so many people are in this wonderment of, could this be? And the answer, you might already have the answer and not even know it. So if you suffer from any of these symptoms, acid reflux, GERD, shortness of breath, pressure in your chest, anxiety, heart palpitations, panic attacks, the problems get more troublesome when you lie down at night. You might wake up gasping for breath or feeling panicky or your heart pounding. Bloating, feeling like things are sort of just stuck after you eat. As I said, long list of symptoms. You can go to the website rootcausemedicalclinics.com and there's a free ebook there, so that will give you more data. But if this is you or someone you know, please reach out. There's a completely natural program that completely works. You do have to be willing to change your diet and lifestyle. There is typically a food component associated with why your stomach's in spasm. Kind of only makes sense that what goes in the stomach is food, and if it's spasming and pushing up, it probably doesn't like something you're eating, but we can figure that out. There can also be infectious processes and imbalance of good and bad bacteria, so a whole list of things that can cause it, but correcting it is not difficult. So please share this with friends, family, anybody you know who has any of these symptoms, because it's very correctable and we love to help. So you can give us a call, 408-733-0400, or visit the website rootcausemedicalclinics.com, and I'll see you soon.